Human papillomavirus, or HPV, is the most common sexually transmitted infection in the United States. It's also responsible for nearly all types of cervical cancers. That's why the CDC recommends kids get the HPV vaccine starting at 11 or 12 years old. Here to tell us more is Janaye Oliver, an Adolescence Immunization Coordinator at the Virginia Department of Health. Welcome, Janaye. How you doing?
I'm great. How are you? Thank you for having me.
Sure. So first of all, tell us a little bit about HPV for people who are not familiar with it.
Sure. So HPV stands for human papilloma virus. It is a virus that's very common in the United States. If left unchecked, it can cause up to 46,000 cancers in both men and women each year. So it's something we really want to keep an eye on, and the best way to prevent it is vaccination.
Okay, and that's what I was going to say. So the vaccination is available for young girls 11 and 12, but also available for boys as well.
Absolutely. So the HPV vaccine is available starting at age 9, really, all the way up to age 26 for both men and women, boys and girls. And so we really encourage families to start at age 9. I don't know about you, but a lot of children do not like getting multiple shots at once. And with the COVID vaccine coming out, there's a lot of shots happening at 11 and 12-year-olds. So we encourage families start at age 9. Start to talk to your pediatrician and get vaccinated.
With all of the talk about vaccines, people obviously are concerned about giving their children vaccines, but this one has been around since 2006.
Absolutely, and it's proven safe and effective, and so much so that the Virginia Department of Health requires it for children entering into 7th grade. We also make it available for free at our 133 local health departments. So it's something that we want to make available to all of you. You can visit our website, vdh.virginia.gov/back-to-school, where you can find more information about the HPV vaccine and all the school-related vaccines for your child.
Okay, getting it at such a young age, 9, 11, 12, is that because parents and doctors want the kids to get it before they think they'll become sexually active?
Absolutely. So our goal is, HPV is about prevention, right? We really like to think of it as a cancer prevention vaccine. And so we want to do it as early as possible. Similar to a seatbelt, we want to do it and prevent without anyone ever thinking about anything related to sexual activity, because we know that this is something that prevents HPV-related cancers down the road in men and women.
If we hone in on Virginia a little bit, what are some of the statistics with people having HPV or, teenagers having as well?
Sure. So, with HPV, we look more at the vaccination records, and we've seen over the years HPV vaccination rates going up. And as the vaccination rates go up, we've seen HPV-related cancers go down. Really at a global level, we've seen cervical cancer rates go down because girls were getting the HPV vaccine first. And so we're really excited to see what happens in young boys and young girls as we continue to increase HPV vaccination throughout the country and the state.
Okay, say you don't get the vaccine and then you go to the doctor and find out that you may have cells on your cervix, and if you're a woman, what happens at that point?
Absolutely. So as I said, we really encourage everyone to get their routine health screenings. And that means getting a pap smear for women. For men, that just means go to the doctor, right? Go to your oral health care visits and learn more about HPV. And if you were to find out you have HPV-related infection, your health provider would, one, help you navigate that and give you the resources as well as treatments for that. And then if not, there are other treatments moving forward depending on the case.
Okay, and you've got a health fair coming up in Norfolk.
Absolutely. Yes. So we have we're really excited this Friday, February 25th from 2 p.m. to 7 p.m. We'll be hosting a women's health fair. It's Women's Health Month next month, so it's a little early, but we're really excited. This event is really for the entire family. We'll be offering free health screenings, as well as vaccination appointments. So if you would like to get your child vaccinated, or if you'd like to get the HPV vaccine, we'll be setting that up. We're partnering with the Norfolk Health Department at the Granby YMCA. And if you'd like to get a mammogram, we're offering those for free as well. Please visit the website, vahealthy.org, where you can set up an appointment for the mammogram. Otherwise, all the other appointments are free of charge, and you can get them as a walk-up.
Great way to kick off Women's Health Month in March. Thank you so much, Janaye.
Thank you.